Typically, the use of non-ionic contrasts will result in fewer reactions. Physicians will generally assess patients to determine their risks for reaction. Patients who take a type of drugs that treat hypertension, AB adrenergic blockers, are at higher risks for anaphylactoid reactions during contrast injections. Patients taking calcium channel blockers are at risk of heart blocks and an abrupt drop in blood pressure if ionic contrast is used during cardiac catheterization. Metformin, or glucophage, is a drug used to treat non-insulin dependent diabetic patients. Patients should continue metformin for 24 hours after the contrast study and resume only after renal functions are checked. Some hospitals require the drug to be discontinued for 48 hours after the contrast study. So how can we help reduce the risk of patient reactions? And what considerations shall be taken into account? To help reduce the risk of a reaction, some patients are prescribed steroids before the contrast injection. Steroids and antihistamines can help reduce or eliminate the allergic effects of ionic contrasts. Prednisone is a common steroid used. It can be given in small doses, 13 hours, 7 hours, and an hour prior to contrast injection. Another option is diphenhydramine, which can be given an hour prior to a contrast injection. A serious but rare adverse reaction that has only been observed in patients with renal impairment is a condition called nephrogenic system fibrosis, or NSF. It is also known as nephrogenic fibrosing dermopathy, or NFD. The disease affects the skin and internal organs. Symptoms include swelling, tightening of the skin, thickening and hardening of the skin at the level of the arms and legs, and sometimes the whole body. The disease is associated with patients with kidney impairment or kidney failure after given gadolinium-based contrasts. The condition is progressive and can be fatal if fibrosis develops in the internal organs such as the lung, esophagus, and heart. The disease was first observed in 1997, and since then, less toxic and safer gadolinium-based contrasts have been developed. There have been no cases since 2009. Iodine-based contrasts are eliminated by the kidneys. It is therefore important that the patient does not have impaired kidney function before the administration of contrasts. BUN, or blood urine nitrogen, is a procedure that checks kidney function. BUN represents the amount of urea in the blood. Urea formed in the liver as the end product of protein metabolism. It circulates in the blood and is then excreted in the urine. Normal levels of BUN are 6 to 26 milligrams for adults and 5 to 20 milligrams for children. An elevated BUN can indicate renal failure, GI bleeding, high protein intake, or low blood supply to the kidneys because of diabetes mellitus, shock, or congestive heart failure. Some medications, such as antibiotics, diuretics, or antihypertensive agents, can also cause elevated BUNs. A low BUN can indicate overhydration or hypovolemia, which is a state of decreased blood volume or decrease in the volume of blood plasma. A low BUN can also indicate liver failure. Creatinine is another test that can be performed to check the functions of the kidney. Creatinine is formed from the breakdown of creatine phosphates in muscle fibers and uric acids from the catabolism of neuric acids. Normal levels are 0.4 to 1.5 milligrams for adults and 0.4 to 1.2 milligrams for children. The amount of creatinine is proportional to muscle mass. Therefore, patients with larger muscle masses would have higher creatinine levels. Elevated BUN with normal creatinine levels could indicate dehydration, whereas an elevated BUN with abnormal creatinine levels could indicate renal insufficiency or failure. Glomerular filtration rate, or GFR, is a blood test used to determine kidney function. It is considered more accurate in assessing kidney function than the BUN or creatinine test. GFRs can give an accurate assessment of the stage of kidney disease. The values can vary depending on the age, the sex, and the body size.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.